teaching critical thinking strategies and skills in the SACME Virtual Journal Club. I am delighted to have over 30 participants pre-registered for this session, and I believe there's about 17 of us today. Jim, can you confirm that you can all hear me? Hello?
Yeah, we're hearing.
I'm still here.
Okay, great. So just very quickly, as I said, teaching critical thinking strategies, welcoming our members as well as non-SACME members who were interested in this topic, and delighted to introduce our presenter today who's going to lead our discussion, and that's Dr. Annette Mallory-Donovan. She joins us as an Assistant Dean and Director of the Office of Continuing Medical Education at Johns Hopkins University School of Medicine. Annette is a dear colleague, and I have a special appreciation for her role, as she's also Vice Chair of the SACME Program Committee, and I'm delighted to be able to introduce you, Annette, to our community. Dr. Donovan comes to us with a huge experience and expertise. So for over 25 years, she has been an educator and really in this space where she holds a master's in higher education and administration and PhD, as well as the master's, as I said, focused on instructional design and curriculum development from Northern Illinois University. So without further ado, Annette, why don't you take it away?
Thank you, Mila, and hello everyone, and thanks for taking time out of your busy schedules. I know it's not easy to always participate in the Virtual Journal Club sessions, so I just wanted to let you know that I appreciate you spending some time with us. So we are going to talk about critical thinking strategies, and we are only going to skim the surface this afternoon because this topic is so broad and so deep that we can only skim the surface in an hour-long session. So quickly, I wanted to mention that I was introduced to higher order thinking skills in the early 1980s when I worked for a federally funded educational lab in Chicago. I had a distinct pleasure of meeting Dr. Howard Gardner, who's the father of multiple intelligences theory, and so it was that sort of stepping stone that led me to further my research on critical thinking, and I focused on this topic for my dissertation. So here are the learning objectives for this session. We are going to discuss the importance of critical thinking skills. We're going to look at a couple of models and taxonomies, namely the Bloom's taxonomy as well as the Elder and Paul elements of thought framework. And then we're going to have a discussion about how critical thinking can be integrated into CME/CPD. So those of you who have joined the virtual journal clubs in the past know that we like to have some discussion. We want the session to be very engaging and interactive. So we do have some moments throughout the presentation where we will call on many of you to discuss your thoughts and offer questions. So I thought we would start with some information about the definitions and history of critical thinking. So scholars and philosophers throughout our history have influenced and progressed the concept of critical thinking by questioning politics, social norms, science, and learning through the use of logic and rhetoric, such as Socrates, Plato, Aristotle, and many others. In fact, this is where we get the Socratic questioning techniques from. So John Dewey is known as the father of modern critical thinking, and he believes that critical thinking is reflective thinking. It's active and persistent consideration of a belief. Robert Ennis, whose definition is widely accepted today, states that critical thinking is reasonable, reflective thinking that is focused on deciding what to do or to believe. So here are some considerations that I thought that we could think about during this 1-hour session. So critical thinking consists of cognitive skills. involving metacognition. So many of you probably have seen that term metacognition before, but metacognition is thinking about your thinking. It's reflecting on one's thinking. And then reflection. Learning by participation involves reflection. The quality of participation can be improved by people reflecting on their thoughts. Developmental. So critical thinking is developmental. It happens over time, and critical thinking is improved through instruction. The purpose of critical thinking, many of the scholars believe, is to cultivate independence of thought, to be able to think on your own independently. And some scholars believe this is truly the aim of education. And then lastly, critical thinking skills, are they transferable skills or are they domain specific? Some scholars, and this discussion was addressed in the article that we provided you, but some scholars believe that critical thinking skills are transferable, that once you develop these skills, you can take them and apply them to almost any situation or any workplace setting. Other scholars believe that critical thinking skills are domain specific, that you have to learn about a particular topic or subject matter and dig deep into that subject matter in order to apply critical thinking skills. So many of us have seen the Bloom's taxonomy model, and basically if you look at the lower boxes there, knowledge and comprehension, those are considered lower order thinking skills. Then when you get to application, analysis, synthesis, and evaluation, those skills are considered higher order thinking skills. Now in my research, I've learned that some scholars believe that people don't actually learn how to do something until they have to teach someone else a concept or a skill. And so that's why I put application at the top, because again, some scholars believe that, well, you really aren't learning how to do something or learning new knowledge until you have to actually teach it to someone else. I know here at Hopkins in our SACME applications, we include the Bloom's taxonomy model in our resources so that physicians and activity directors who want to sponsor a SACME activity, we try to get them to understand that if you are going to host or sponsor an advanced course in something, whatever that subject matter is, you really want to focus on those higher order thinking skills. You want the participants to be able to analyze, synthesize, and evaluate. So Bloom's taxonomy is considered an older model, and Linda Elder and Richard Paul produced this new model. It's called the Elements of Thought, and it's a framework. And so I'm going to just spend a few minutes going around the circle here. We're going to start with we think for a purpose. So they propose that whenever someone is thinking, you're thinking for a purpose. And then I want you all to ask yourself, just to reflect for a moment, when am I not thinking? Is it possible to never think? So anyway, think about that as we're going through the model. So with that in mind, we think for a purpose within a point of view. Usually it's probably our own point of view. But we also have some assumptions about what we're thinking about. These assumptions lead to implications and further assumptions. And then when we're thinking about something, if we're trying to solve a problem, we use data, facts, and our own personal experiences to make inferences and judgments. And then sometimes we'll think about theories based on concepts and theories, what theories are related to our inferences and judgments to answer a question or solve a problem. And so Linda Elder and Richard Paul believe that, of course, we're always thinking. I don't know if there's ever a time that we're never thinking unless we're sleeping. But when we're trying to solve a problem or answer a question, that cognitively we go through these process steps. So here are some key points that we want you to keep in mind. And I've mentioned this already, but critical thinking consists of complex sets of skills and these skills are cultivated over time. They're developmental. Critical thinking integration should receive attention within the higher education and K through 12 school systems. When you think about critical thinking, the goal is to create competent healthcare professionals who learn by participating in communities of practice. And so I think that the third bullet point really sort of summarizes what we'd like to do, what we think we're doing in CME and CPD. And then the last bullet point, which was addressed in the article as well, is that critical thinking fosters a caring attitude, empathy, and commitment. So in a sense, it's the ethics of care. And for me, even though I've done extensive research in critical thinking, this piece was new for me. This component was new. And so it gave me a chance to do some reflective thinking on my own. So at this point in the conversation, we have integrated a couple of discussion points and questions. And so Mila, I'm going to turn it over to Mila so that she can ask everyone this question.
Thank you, Annette. I see that we have several additional folks who joined us since we first started, and just wanted to reiterate a couple of points. So in in preparation for our session today, we posted a number of website pages as well as resources, as I said, in preparation for the topic in the session today. The article that Dr. Donovan has referenced is one from the Learning and Instruction. So it's the Critical Thinking as a Citizenship Competence Teaching Strategies from Pandam and Monique Ballman. Obviously, this is the one where, you know, the critical thinking skills in teaching those concepts is really put in the social constructivist point of view, and leans more into the social aspects of learning and the communities that it engenders. So I also would like to say, because I neglected to say that if you'd like to raise a hand and contribute to the discussion, the way to do that is you will see there is a hand. You just click on that icon, a hand, then I will unmute you and you will be able to speak. So when I thought about what was presented so far, and in general the topic of critical thinking skills and where that training and developmentally belongs really, it sort of raised the question of what is our role? Are we supposed to teach the skills at the point where we are in our space of continuing professional development and dealing with clinicians who are learners, or is there something else that we should be paying attention to? So I'd like to open that up for discussion and for comments now. If you'd like to contribute, as I said, raise your hand and I will unmute you. Looking for volunteers. Anybody? Okay, I see we have Dr. Mike Schoen. I will unmute you, Mike. You can speak now. Go ahead. Mike? Mike Schoen, can you hear us? Mike? Can you hear us, Mike Schoen? Go ahead. Okay, I don't think that, let's see. Can you hear us now? Mike, you can speak. Jim, am I doing something wrong?
It looks like he should be able to talk. It might be something on his end.
So Mike, I see that you've raised your hand and you are unmuted.
Oh, I do see we have a question in the question box.
Yeah. Okay. For some reason, I cannot see the question. Unfortunately, we cannot get Mike to speak, looks like. Is there anybody else? You know, we will try to get to Mike
Oh,
in
I
a
see
little
what Mike's
while.
about. Mila, Mike is going to be maybe a couple minutes till I can get him.
Okay.
Yeah.
Troubleshoot. Is there anybody else who'd like to contribute? Any thoughts on anything discussed so far that Annette has presented? Or to help us think through the question that we have posted? Okay, I'm going to have to call on some of you. How about Jack?
Hi, Mila.
Hi. What are your thoughts?
Well, you would hope that critical thinking is something that has developed over time, that starting in elementary education moving forward, these skills get honed. A person to be thinking critically probably has to have a certain amount of self-confidence in the depth of knowledge of the topic and be able to pick up dissonant aspects of it, and that dissonance, I think, probably causes some discomfort, and that prompts the, but wait a minute, what's going on, that one might, what we hope to engender in critical thinking. Back to you.
Thank you. Thanks, Jack. I see that maybe we can try Mike now. Mike, are you available now? Mike Schoen? Not yet. Okay, I also see that Leanne has raised her hand, so let's go to Leanne. Leanne, go ahead.
Can you hear me, Mila?
Yes, we can hear you.
All right. So I was looking at whether it was our job to teach critical thinking, and I kind of believe that that is already well underway. I think it's more of our job to help develop it and or enhance what our learners already have.
Great, thank you for that. Let's see if we can get Mike online. Mike, can you speak now? We seem to have a problem there. I apologize for that. Sometimes it's, Leanne, do you have something else to add? I see you raised your hand again. Go ahead.
Oh, no, I was just trying to lower the hand.
Oh, okay. You don't have to do anything, I think, afterwards. Now it looks like it's raised. And anybody else who'd like to contribute to this discussion? Here we have John. John, go ahead. John Wright?
Oh, I didn't realize I was unmuted. Well, it seems to me that we all have to teach critical thinking in anything, and the principles like of investigative journalism and evidence-based medicine come into play in any teaching program. You really can't make assumptions. At least you have to remind people to think critically and to renew their skills.
Yeah. Okay. Well, I think that's a valid and good point. So, if we have, let me see if there's anybody else who has a hand up or would like to contribute to this. If not, Annette, maybe we can get to the next question.
Sure. Here's the next question. How do we as teachers and educators apply critical thinking strategies to support learning in CME CPD?
So I think this is where we were heading in our discussion of the previous question even, in how do we further develop and apply even as critical thinkers and instructors and educators, how do we support critical thinking skills and development in furthering the knowledge, skills, and competencies, considering that, you know, it is a competence really that we're trying to develop further. So any thoughts on that? I know you guys are doing this and thinking about this a lot as instructional designers, as faculty in courses, as educators in your daily lives, and would love to hear about it and your thoughts. So, going to call on somebody. Mary, what are you thinking?
Hi, Mila. Can you hear me?
Yes, we hear you well.
Okay. I've been thinking about what Annette presented in terms of where critical thinking starts, K-12, et cetera, and I think it's quite true that you can start to nurture children who think this way. They don't just accept everything. They start to ponder whether or not they believe something is really true. And I think by the time we get the continuum of medical education in our presence, with the medical students, the residents and fellows, and then our faculty as well as our all of the rest of the learners, I think most of them have adopted or learned excellent critical thinking skills. The question is whether or not they're always applying them to what they're learning and whether or not they can pass them on to the residents and the medical students they're interacting with at maybe an even higher level. They have to be more discerning, I think, and more critical. They have to do more of a higher order of critical thinking, if that makes sense, and that maybe you can help me out here.
Right.
In order to push the students and their own peers to think even more critically about what's being presented, whether it's evidence-based, whether it's cutting edge, whatever.
I think, thank you, Mary. If I understand you correctly, I think you talking about this competence, almost like it's a competency development for faculty development. Is that what you're getting at?
Yeah.
And that's in our space, right?
I think that most of our faculty would say they're critical thinkers.
Right.
And yet, we've had examples of situations where we've all had this, where we know that they may have been looking at whatever it might be, something that doesn't match guidelines or something that may not be the best research, and yet they haven't necessarily brought the highest order of critical thinking to their assessment of that information. And what we're pushing them to do is to always do that and role model that for the people they're teaching.
Right. So what are some of the strategies that you think of that we could be all employing and using in developing this competency? So Leanne has raised her hand, maybe answering this or contributing to something else. Leanne, go ahead.
Oh, sure. And actually, that was the part that I was kind of thinking about as well, because it says, how do we as teachers and educators apply it? And when we're, let's say in a live course or even at a regularly scheduled series, getting as much participation as you can, and bringing about live or kind of real-life situations, clinical situations, case-based, problem-based, and getting everyone in the audience not only to think a little bit more about it, participate in it, and building kind of off of other people's comments.
Thank you for that, Leanne. That's critically important. It's that social aspect, I think, and the article gets really well at that, of where the learning happens in the social setting, and how the exchange of ideas really contributes to not just the inquiry process, but the building of the thought process. So anybody else? Any thoughts on this? Strategies we employ or could employ or or should speak about? I see Suzanne Zemnick raised her hand, so Suzanne, go ahead.
Oh, hi, Mala. So on a very practical level, I think this really speaks to faculty development as we need to educate our planning committee members and faculty in the need to more purposefully design our education in the higher order skills and in that articulated as it relates to applying critical thinking. I'm just reflecting on this for myself. I've never had the conversation, or my staff have not, in relating that higher order sorts of learning opportunities that lead to application and upward in the framework of critical thinking. And so I think that we need, as CME professionals, to be working with our thought leaders and planners to even help educate them on this concept. And I think even these slides would be very helpful in that area, as well as the resources. But again, like many things, I think it comes down to faculty development.
Absolutely. Thank you for that, Suzanne. We also have a comment from Louise Talazar, who's bringing up an important point as he thinks about the topic, and he says, as we move more toward into professional education, having participants consider how their roles intersect with others' roles, this will help to foster critical thinking. Thank you for that comment. I think that's very well put and an important topic for us as we consider in professional education increasingly in our domain of development. Do we have anybody else who'd like to contribute to this topic? If not, why don't we see Annette, do you have any additional thoughts on the strategies that you can help us think through?
Yes, I do, and I've listed some of the strategies on the next slide. And by the way, my strategies are similar to many of the participants who were able to provide their thoughts and input. So we, I think a while ago, we had a discussion about flipped classroom environments. And so one way to increase critical thinking is to ask students to reflect on their point of view regarding some concepts and ideas prior to the class, so that when they show up at the class or the learning environment, they can share their thoughts. They have some time to really think clearly about what their thoughts are on certain concepts, and then in the actual classroom environment, the teacher becomes sort of like a facilitator, a moderator, and can help students connect their prior learning and their reflections to the new knowledge that they're learning about. Many of us are familiar with cooperative learning techniques, and so you gather students into small groups, and I put the word virtual there because sometimes these groups can be virtual as well. And these groups can work on group projects, they can have discussions, debates, and peer-to-peer interactions. And so, again, you're sort of putting the learning onus on the individuals, but you're allowing individuals to share and learn from each other, opposed to the instructor or the lecturer being the person who has all the knowledge. And I know with some of our SACME activities, this may work in some environments, it may not work in others, but the idea there is to not always have a talking head, you know, for all the live activities that we coordinate. And then someone mentioned to use real-world examples, and those certainly do help with fostering critical thinking. And so I put simulation there as well, because for those of you who are going to join us at the spring meeting, the SACME spring meeting, we will have a chance to look at a simulation lab. And so research supports that simulation helps foster critical thinking. Someone mentioned an interdisciplinary approach. So the integration of ideas and courses across disciplines have shown to increase critical thinking skills. Having students work on independent research projects and giving them time to be able to inquire about certain topics. So you want to promote inquiry. You want to help them make inferences. You want to help them to make those connections. And again, you want to give them time to reflect. We all know that we have different types of learners, and some people learn by reflecting, and I'm actually one of those individuals. And so some of these techniques are not new, but again, these techniques can foster critical thinking skills. So you can have paper critiques by the instructors and the peers, class presentations. After working in those small groups, have certain members of each group give a class presentation. And then the last bullet point is in-class problem-solving community projects. So Dr. L.D. Fink is an international consultant in higher education, and he wrote a book entitled Creating Significant Learning Experiences. So I had a chance to hear Dr. Fink speak at one of our professional development seminars here at Hopkins, and I was very impressed with him. So his idea there is that when you create time in the classroom for students to work on problems, and when you try to integrate community projects, those community projects will foster the ethics of care, which I'll go over in the next slide. But I wanted to stop there, Mila, to ask if anyone else had any suggestions or comments about the strategies listed on this slide.
Thanks, Annette. So again, an invitation for discussion. I'm opening it up to the floor, so to speak, to all of you. Any additional thoughts on the strategies? There was an interesting point raised in the article about the inability, really, of the research to prove the effectiveness of courses or instructional materials specifically designed to teach critical thinking. And I wonder if there's something that others would like to contribute to that. And then further on, the authors raised the point that the integration into the subject matter is important. So in a way, do we teach critical thinking? Of course, there are strategies, but it's an individual, it seems to me, sort of development, our professional and personal, rather personal development competency that then contributes to our social interactions, professional interactions, and effectiveness in our daily lives. Annette, would you like to add anything about the research that has been done on how to and what is effective, in addition to what you already talked about?
So, sure. Thanks, Mila. So actually, I want to talk about another part of the article, and I mentioned it in an earlier slide. And if you don't mind, I'm going to go back to that slide. And it's regarding whether or not critical thinking skills are transferable or domain-specific. And so the article by Tendam and Monique Ballman, I could tell that these authors were persuaded to think that critical thinking really takes place in domain-specific areas. And based on my research prior to today, I was leaning towards the other concept in terms of critical thinking being transferable. And so when you think about all the jobs that we all have had and the skill sets, you could be a coordinator, a manager, or higher than that, a director of a department. And we think about those skill sets that you sort of honed along the way, and so the question is, do you think that some of those skill sets have been transferable? Were you able to transfer some of those skill sets to different working environments? And so I would say yes, in fact, with my own experience, I've been able to transfer some of those skill sets. And so when you think about or you talk about analysis and synthesis and evaluation, even as consumers, we evaluate and compare and contrast the quality of products and prices. Some of these skill sets we use every day, whether we're at work or at home. And so I must admit that I'm in that camp of people who think that skill sets, critical thinking skills, are transferable. Now, obviously, I didn't study as a surgeon, so I couldn't go in and operate on someone's heart. So I think to some degree the critical thinking skills must be domain specific in order for us to train the healthcare professionals in their particular disciplines.
So it's within the realm of application that it gets to the specific. Thank you for that. I see that Mary Turco raised her hand, so go ahead, Mary.
Hi, I had another question for Annette, which had to do with SACME research as well, and it has to do with the idea that if you do in-class problem solving and particularly community projects, I'm wondering, does that suggest that, for example, a quality project that might be suggested based upon a conversation within a discussion, an in-class problem-solving discussion, let's say, perhaps someone's doing that in a morbidity mortality round or a Keys conference or whatever, that would motivate more critical thinking that might lead to a quality project?
Mary, thank you for that question. And yes, I would say that it could, and it certainly might lead down that direction. I find that many times when people are having conversations and when you allow people that safe space in a learning environment, so it may not be a classroom, it could be an RSS, a regularly scheduled series at grand rounds, but when you allow people a safe environment to offer their thoughts, their input, that you'd be surprised as to how many people have different perspectives on things or different way of looking at something, looking at a problem. And so when in the seminar with Fink, he suggested that with the in-class problem-solving strategies that the instructor, the lecturer, has to allow time for this type of learning to take effect, because as you know, sometimes these small exercises take time, and so I think oftentimes that could be a limitation to this type of cooperative learning, is that it does take time to reflect and to foster. And so I wanted to speak to your point about quality projects. So our institution just became an MOC Part 4 portfolio sponsor, and we are looking at more ways as to how we can integrate quality improvement into CME, CPD. And so I would imagine that those types of conversations and discussions could lead to the beginning of many quality improvement projects.
Thank you.
Thank you. Thank you, Mary and Annette. Are there any other questions for Annette at this point, or anybody else wants to contribute to the discussion? If not, we can move on and really start thinking about, I think we've tackled this to a degree, but here's the question of so what? Why does it really matter that we embrace the concept of being mindful in developing curriculum, in developing conferences that we do, in paying attention to faculty development, and the influencing that we can provide from distinct roles that we play in the educational process. So Mary's hand is up again, or still, I'm not sure, but Mary, would you like to say something? Oh, it went away.
Hi.
Go ahead.
Yeah.
All right. So I know that many of you are not easily scared away or have a lot to contribute and can and are thoughtful about the topics that we usually present. So any thoughts? Leanne, go ahead.
Hi there. And you know, when I got to thinking about the critical thinking and why does it matter, and why, you know, should we be putting more efforts, kind of several things really stuck out to me in some of the articles that you guys shared. And the one was how important the reflection piece is. You know, and that goes to the heart of what I think the critical thinking has to do with. Yes, looking at the real world examples, yes, going through and being able to observe and initiate and practice. But unless you have that reflection piece, you don't bring it around to what have you learned, what have you been able to apply, what do you still need to work on, and your exact question of why does it matter? Whatever we're learning, why does it matter? And you get to that with the reflection.
Right. Thank you for that great point. So, yes, it's important to reflect, to question our thoughts and our opinions and those of others. And, you know, if they say that real learning really happens when questions lead to additional questions. And maybe as educators, we pay attention even to that. It's less in providing superficial answers and more maybe in developing those thoughtful and developmental questions that lead to furthering knowledge. I see that Dennis has his hand up. So, Dennis, go ahead.
Hello, can you hear me?
Yes, we hear you. Go ahead.
Oh, I didn't know this thing really worked.
It does.
It's been a great discussion, and obviously critical thinking is at the basis of clinical care, whether it be for a physician or nurse and so on. So it's obviously there. I was reflecting on the fact that we lost over time some wonderful examples of critical thinking when we sort of did away with the CPC in many places, the Clinical Pathological Conference. But as a medical student, as a resident, as a practicing clinician, to see a clinician struggle with trying to come to a finding when absolutely the pathology was going to tell you what the result was, taught me so much to see how an expert goes through the steps one by one, rules out others, and so on. That to me is something we can do for clinicians, demonstrate how to critically think by showing experts doing it.
That's a great point, Dennis. Thank you very much. You know, I was thinking about in quality improvement and performance improvement that many of us engaged in these days of getting to root cause analysis and asking, you know, the 5 whys as a technique, and that certainly, I think, contributes to developing critical thinking skills and furthering the understanding of the subject matter and the problem solving. Do we have anybody else who would like to contribute? I'm looking for volunteers. Thoughts? I know somebody who I'm sure has thought about this and is thinking about how to make it more practically applicable. Pam, how about that? Pam McFadden, what are your thoughts? Pam? Okay, I don't think we can get Pam. Let's try again. Can you hear us? All right. Anybody else? There's Stephanie. Okay, Stephanie, you are unmuted. Go ahead.
Hi, it's Jack Ladson. Thought I had about this were a couple of things. Is, you know, when you look at medical students and you look at residents and you look at practicing physicians, there were two really excellent books that were produced, which I think emphasize a lot of this, quotes, critical thinking. But first of all, I think you can only model critical thinking. You can't teach critical thinking. What you can do is you can teach the elements of critical thinking. But for somebody to really start to critically think, you model. And I think that's why the CPC, as old-timers, the CPCs were invaluable. And New England Journal of Medicine CPC every week is great from that point of view. But there were two books that I think I've used with our residents, with our students and residents. One was Groupman's book on how doctors think, where he actually went in and just analyzed how physicians came to conclusions. And if you really go through it, you see some of the critical thinking. But then there's McFarland's book, which is really more basis in education, which is how doctors think as well. And that gives you a lot of the elements of thinking. And as I read through her book a number of years ago, this is why I came up to the conclusion that you really can't you can't teach critical thinking. You can only really model it. And I think it's critical, word critical again comes up, that if you're going to try and get this across to students, medical students, residents, and even before that, it really is putting them in an environment where the individual really models and gets the students to ask questions, and you asking questions of the students. And I think that's the way you start to develop their critical thinking process.
Absolutely. That's a great point. Thank you for that. So, go ahead.
Can I just add, like in the same vein, so Dr. Lazarson talked about modeling, and so that made me think about, you know, I always really value in other people if they have a differing opinion and see something from a totally different point of view. That helps me really think about it critically. And so I think that, you know, we can't teach critical thinking. I agree with that. But we can encourage people to be open-minded, because if you're not open-minded, you can't see something from another point of view. You're only, so I think, you know, critical thinking and doctors and scientists are supposed to be the ultimate cynics, right? So we're supposed to disbelieve everything until you can absolutely prove that it's there. But that shouldn't allow us to have pigeonhole thinking. And so what I've learned in just personal interactions, in hearing points of view on anything, it doesn't have to be medical, but just different points of view allows me to go, oh, I never thought about it that way. And those are the people I, frankly, try to hang out with so I can be better, because at least they're modeling something besides what I offer myself.
I also would point out that, you know, there's a difference to me about clinical reasoning and critical thinking. And I think that's an important point, because most physicians, et cetera, that go through, they're really doing clinical reasoning based on information they have, or they look up at things along that line. But critical thinking is a higher level, much higher level than clinical reasoning. And I think that's what we're really getting at. What is it we really want students, if I'm talking about just the medical profession, what do we want them to really learn? Do we really want them to learn clinical reasoning? Do we want them to be able to be critical thinkers? I think it's a very different discipline and level of education that you demand of them. And it gets back to what we were talking about before, is the evaluation process. Unless you design your evaluation process for critical thinking, students will never go towards it. Okay? And I think the evaluations, you all know, in education, the evaluation drives the curriculum.
Those are great points. Thank you both. Annette, would you like to respond?
Yes, I do. Thank you. So many of you hit on some really key components, and that is, let's talk about reflection for a moment. So reflection gives the learner the time and opportunity to reflect on the new knowledge, new concepts, and try to make those connections. They try to connect their prior knowledge to the new information. And so, and many of us in education will say, oh, I saw the light bulbs go off in their heads. And so that's what they're doing. They're actually making those connections to see, you know, how does this new information apply to what I know already and what I'm learning now. But then the next question is, what else do I need to know? What's missing? What are the gaps? And so reflection is really the underpinning to critical thinking. And then the other comment I'd like to make is that there's been some discourse about questioning and asking questions. And so Richard Paul states that an active mind is a questioning mind. If you have a room full of learners who are not asking questions, then their minds are dead. They're not active. And so one way to determine whether or not people, the learners, are really engaged is if they're asking questions. And of course, you know, as the facilitators, you can use a Socratic questioning technique by, you know, when they ask you a question, you sort of turn it around to ask them a similar question. Well, what do you think? You know, what do you think the next steps are? Or why do you think this wouldn't work in this case? So I think you all bring up some really good points. And so then, since we are valuing each other's perspectives, different perspectives, so a comment was made that critical thinking can't be taught. And so I agree that it has to be modeled, but modeling is a way of teaching. It's a teaching strategy. So from my perspective, critical thinking, well, you can expose learners to critical thinking concepts and strategies, right? So from an educator's perspective, I think that you can teach someone how to think critically, but again, it's developmental. It happens over time, and it has to be cultivated.
That's great. Thank you so much, Annette. Do we have anybody else who'd like to contribute at this point? I'm looking for volunteers. If not, Annette, would you like to move on to your conclusion?
Yes, we actually have one slide left. The last slide just is questions. So if there are other people want to ask questions or make comments, but I'm hoping that this slide sort of summarizes what we've been talking about. So why does critical thinking matter? And so our jobs as educators in CME and CPT really is to create competent healthcare professionals through the education that our offices provide. And then we know that many people learn by participating in communities of practice. And so I think the more we can create more engaging live activities or webinars, the more engagement we have, the more time we give people to ask questions, to help them understand the concepts being taught, and also to give them time to reflect. I think that we would increase the participation, but also increase those critical thinking skills. And then lastly, based on one of the research articles that we shared, that what we're hoping to do with critical thinking and getting people to think more critically is to promote and develop citizenship. Obviously, we want people to give back to their communities in a meaningful way, and we want them to hone in on those skills so that they can provide better patient care, which of course is the end result, one of the end results to our work, one of the outcomes, I guess you could say. So are there any questions or comments? I can go back to that slide if you want, but this is the last slide. We're asking for additional questions and comments. And I just want to thank everyone for your time this afternoon.
Thank you, Annette. We do have actually a comment from John Wright, who wants to make a comment on NCQA. So, John, why don't you go ahead? I unmuted you.
Okay, thank you. I hadn't expected to comment, but the Socratic method is very provocative. I think the greatest model we have out there right now is the whole CMS movement towards value-based, quality-based compensation as opposed to fee-based for services. And on top of that, we have the NCQA and others promoting the patient-centered medical home, where doctors are being forced to rethink how they work to improve accessibility and communications and teamwork, interprofessional cooperation, and most of all, meaningful uses of the electronic health records. It's kind of a revolutionary thing that's happening that's going to force a lot of critical thinking through the modeling that's being imposed.
That's a very, very good point. Very good point. Do we have any more, thank you, John. Do we have any more questions for Annette or anybody else who would like to contribute to any final thoughts to the discussion on the topic? Anything we've talked about this afternoon? If not, I would just like to remind everybody that SACME Journal Club has several pages on the website. It's www.sacme.org. You can find the virtual journal club. It has 4 or 5 pages. There's one called discussion area. And so there were mentions of resources, additional resources that I would love for you to maybe post in this discussion area for today's session. And we can certainly continue to talk about any of the topics that we've tackled so far and future ones offline and in this asynchronous way. I also would like to remind you that for any of you who like this format, enjoy what we all learn and the ideas we exchange and you know, a bit of a reflection, we conduct as a community. There is an archived section, so any of the sessions that you have missed, you can, or you'd like to go back to, they are available to you. So there's an audio and with slides available for each of the sessions on the website. With that, I want to thank Annette. I want to thank all of you for your discussion and remind everybody that our next session will be June 3rd. We are thrilled to have Dr. Alan Knox join us, and he's going to talk about the active engagement. So again, we'll try to do something a little bit different in June, and I hope that you will enjoy it because this will be working with the Wisconsin Office of CME as well as Dr. Alan Knox. I want to thank you all for participating, and I'll let you go a minute to the hour. Thanks again, and farewell.
Thanks, everyone. I appreciate your time this afternoon.
Bye-bye.